How can healthcare professionals help patients to critically appraise social media information? In the digital age, social media platforms have become a pervasive source of health information. While they can connect individuals and raise awareness, they are also rife with unverified, misleading, or even harmful content, particularly concerning complex conditions like pain and musculoskeletal disorders. A common misconception among patients is that the number of followers or the fact that some content creators label themselves as experts or specialists directly correlates with the credibility or scientific validity of their advice. Healthcare professionals have a critical role in addressing this belief, guiding patients to critically appraise online sources, and understanding that popularity does not equate to scientific authority in pain management. What does scientific evidence say about health misinformation on social media? 1. High prevalence of health misinformation. Health misinformation regarding chronic musculoskeletal pain and musculoskeletal conditions is widely disseminated and often goes unchallenged on social media platforms. Such content can spread faster and further than accurate information, making it difficult for individuals to discern reliable sources. 2. Lack of credentials and peer review. Unlike peer-reviewed medical literature or professional clinical guidelines, content from social media influencers often originates from individuals lacking formal medical or scientific training in pain management. Their advice is not subject to rigorous scientific scrutiny or external validation, leading to potentially inaccurate or anecdotally driven recommendations. 3. Risks of inappropriate self-treatment and delayed care. Following unvetted advice from influencers can lead to patients engaging in ineffective, inappropriate, and even harmful self-treatments. This can result in wasted resources, exacerbation of symptoms, and importantly, delay or discontinuation of evidence-based care, potentially leading to poorer long-term outcomes. 4. Commercial bias and financial incentives. Many health influencers operate with significant, often undisclosed, financial conflicts of interest. Their content may be sponsored by products such as supplements or devices, or designed to drive traffic to their own paid programs or services, regardless of scientific efficacy. This commercial imperative can compromise the objectivity and trustworthiness of their health recommendations. How can you help patients appraise social media content? 1. Validate patients' information seeking. Acknowledge that patients often turn to social media for information and support. Frame the conversation not as judgmental, but as a collaborative effort to ensure they are getting the best, safest advice. 2. Educate on source credibility beyond popularity. Explain to patients that a high follower count or a slick presentation does not equate to expertise or scientific validity. Guide them on key markers of reliable health information such as peer-reviewed research, qualified licensed healthcare professionals, and reputable health organizations such as the World Health Organization or national professional bodies. 3. Teach critical thinking and recognition of red flags. Empower patients to be critical consumers. Provide the following clear red flags to watch out for. Too good to be true promises. Rapid, guaranteed, or universal cures. Anecdotal evidence only. Reliance on personal stories without scientific backing. Selling products or programs. Advice tied to specific commercial interests. Claims of secret cures or industry conspiracies. Lack of scientific references or credentials. And 4. Position yourself as a trusted guide. Reiterate that healthcare professionals are partners in navigating complex health information, offering personalized, evidence-based advice tailored to the patient's unique condition and needs. Encourage patients to bring questions or information they find online for discussion. Let's put it in practice. Dr. Palsun, a family physician, is speaking with Ms. Anne-Marie, a patient in her 40s, who has chronic low back pain and has tried an expensive detox supplement promoted by a social media influencer.
Mos Anne-Marie, I see you've been trying a new detox supplement.
What led you to try it?
I saw this amazing influencer, Wellness Guru X, on Instagram. Millions of followers, incredible testimonials about curing pain. She seemed to really understand my struggle.
I appreciate you sharing that. Social media can be powerful, and it's easy to be drawn to popular figures with compelling stories. But with health advice, popularity doesn't equal medical expertise or scientific proof.
What do you mean? Her advice must be good, right?
Unfortunately, no. Many influencers lack medical training, and their advice isn't scientifically reviewed. Claims like detoxing aren't supported by evidence. Our bodies naturally detoxify. My concern is these unproven remedies can waste your money, potentially cause harm, and delay you from getting effective, evidence-based treatments.
So, the detox isn't helping my pain?
It's highly unlikely. When you see health advice online, especially if it promises a quick fix, sounds too good to be true, or is tied to selling a product, those are so-called warning signs. Always ask, does this person have real medical training? Is their advice based on actual scientific studies, or just personal stories?
I hadn't thought about it that way. She just seemed so knowledgeable.
I know it can be confusing. Please, feel free to bring any health information you find online to our appointments. We can discuss it together, and I can help you evaluate if it's truly a reliable and safe option for your pain management. Your well-being comes from sound, evidence-based care.
To sum up, it's vital for healthcare professionals to proactively address misinformation from social media influencers. By helping patients critically appraise online health content and understand that popularity doesn't equate to scientific credibility, we empower them to make informed decisions, avoid harmful practices, and prioritize evidence-based care for effective pain management.